And just, yeah, those are the primary thing. Those are the primary diagnosis is you're seeking to put a marker on it and boldly claim that this is the correct diagnosis.
Okay.
And,
Okay.
and please understand, this is an advanced perspective because almost every medical doctor doesn't understand this. They have no clue.
Okay. So, um, okay. I'd like to start with hereditary hemochromatosis.
Sure, sure.
Okay.
So start wherever you like.
Okay. So, um, when it comes to diagnosing iron issues, it can get very complicated.
Mhm.
And the nice thing is that you can always fall back on labs, and you don't really want to just use symptoms to guide you, because
Mhm.
if you're using symptoms, then this person is well far down a pathological path that you could have potentially stopped years ago, if not
Mhm.
decades before. So the first, if we talk about hereditary hemochromatosis, iron overload, iron deficient anemia, copper deficient anemia, other anemias, hemolytic anemia, like what you deal with, um, there's different labs that basically you need to know and understand, and genes as well. And
Mhm.
so the first one I want to discuss is hereditary hemochromatosis. So hereditary hemochromatosis is when you have inherited one of three hemochromatosis genes, which cause you to increase iron absorption by decreasing hepcidin, which hepcidin is this molecule that it's a protein that your liver makes. And if you have this gene, the hemochromatosis gene, you don't make as much hepcidin, and then you absorb more iron, and that can become pathological because over time it's like you just keep getting more and more and more, and you kind of become this iron hoarder, and your body runs out of places to put it,
Mhm.
because first it wants to put it in the liver, and then the liver overflows, and then it'll go to the next place, whether that's your heart or your pancreas or your brain, pituitary gland, gonads, ovaries, testes, skin. Eventually it will go everywhere because the body has evolved to hold on to as much iron as possible.